Influenza, commonly known as the flu, is an infectious disease caused by the influenza virus. The existence of the disease has been known for centuries, with records of flu-like symptoms dating back to ancient Greece and Rome. However, it wasn't until the early 20th century that the actual virus causing influenza was discovered. In 1933, British scientists Wilson Smith, Christopher Andrews, and Patrick Laidlaw were the first to successfully isolate the influenza virus in ferrets at the National Institute for Medical Research in London. This discovery was a significant breakthrough, as it allowed researchers to better understand the virus's structure, transmission, and behavior, ultimately leading to the development of vaccines and antiviral medications to help prevent and treat influenza. Influenza, or the flu, is primarily transmitted through respiratory droplets that are expelled when an infected person talks, coughs, or sneezes. These droplets can infect others in several ways. Direct contact. When a person comes into close contact with an infected individual, the droplets can land on their mouth, nose, or eyes, causing infection. Indirect contact. The respiratory droplets can also land on surfaces and objects, such as doorknobs, keyboards, and countertops. When a person touches these contaminated surfaces and then touches their mouth, nose, or eyes, they can become infected. Inhalation. In some cases, the respiratory droplets can remain suspended in the air for a short period, especially in enclosed spaces with poor ventilation. If another person inhales these droplets, they can become infected with the flu. It is important to note that a person with the flu can be contagious even before they start showing symptoms, which is why the spread of influenza can be challenging to control. To reduce the risk of infection, it is essential to practice good hygiene, such as washing hands frequently, avoiding close contact with sick individuals, and covering your mouth and nose when coughing or sneezing. Additionally, getting an annual flu vaccine can help protect against the most common strains of the virus. Influenza, commonly known as the flu, is a viral infection that primarily affects the respiratory system. Symptoms of influenza can range from mild to severe and can sometimes lead to complications, especially in high-risk individuals such as young children, the elderly, and those with compromised immune systems. Common symptoms of influenza include fever, a high temperature, usually over 100.4 degrees Fahrenheit, 38 degrees Celsius, is often one of the first signs of influenza. Chills, feeling cold and shivering, even when wrapped in blankets, is a common flu symptom. Muscle aches and body pain. Influenza can cause aches and pains throughout the body, particularly in the back, arms, and legs. Headache. Many people experience headaches during a bout of the flu. Fatigue and weakness. Feeling extremely tired and weak is common during an influenza infection. Cough. A persistent, dry cough often accompanies the flu. Sore throat. Inflammation of the throat can make it painful to swallow. Runny or stuffy nose. Influenza can cause nasal congestion and a runny nose. Loss of appetite. Many people lose their appetite when they have the flu. Sweating. Flu-related fevers can lead to sweating as the body tries to cool down. In some cases, influenza can lead to more severe symptoms and complications, such as difficulty breathing, chest pain, or signs of dehydration. If you or a loved one experiences severe symptoms or if the flu symptoms do not improve after a week, it is essential to seek medical attention. It's important to note that the flu can sometimes be confused with the common cold, as they share some similar symptoms. However, flu symptoms tend to come on more suddenly and are usually more severe than cold symptoms. Treatment for influenza primarily focuses on relieving symptoms and preventing complications. Most cases of the flu are self-limiting, meaning they resolve on their own without specific treatment. However, there are several steps you can take to manage symptoms and promote recovery. Rest. Allow your body to heal by getting plenty of rest and avoiding strenuous activities. Fluids. Stay hydrated by drinking water, clear broth, or warm lemon water with honey. This helps to thin mucus and replace fluids lost due to fever and sweating. Over-the-counter medications. Pain relievers and fever reducers, such as acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, can help alleviate body aches, headaches, and fever. Decongestants and cough suppressants may also provide relief from nasal congestion and coughing. Be sure to follow the dosage instructions and consult a healthcare professional if you are unsure about which medications are appropriate. Antiviral medications. In some cases, especially for high-risk individuals or those with severe symptoms, a doctor may prescribe antiviral drugs, such as oseltamivir, Tamiflu, zanamivir, Relenza, or baloxavir marboxil, Xofluza. These medications can shorten the duration of the flu and reduce the risk of complications when taken within 48 hours of the onset of symptoms. Humidifier. Using a humidifier can help moisten the air, which may provide relief from a cough and a sore throat. Gargling. Gargling with warm salt water can help soothe a sore throat. Warm compresses. Applying a warm compress to the forehead or neck can help alleviate headaches and sinus pain. If you suspect you have the flu, it's essential to stay home and avoid contact with others to prevent the spread of the virus. If you experience severe symptoms or have concerns about your illness, consult a healthcare professional for guidance. In addition to these treatments, getting an annual flu vaccine is the best way to prevent influenza and reduce the risk of complications.